Morning, colleagues. My name is Kosi Tuntuli. I'm from the Research Capacity Development Unit at the Postgraduate School. I'd like to welcome each and every one of you for taking your time, and thanking you, colleagues, for taking your time in attending this workshop, which is titled Action Research, Bridging Theory and Practice. And we are honored to have Dr. Lorenzo David as our facilitator for this workshop. Thank you, colleagues, once again to everyone, and thank you to our facilitator. We do hope and believe this will be a great session where everyone will learn something from today's workshop. Before we can move on, colleagues, we have recorded the workshop. It's currently recording, so we will share the recording of this workshop on the RCT management system. The recording will be available by end of the business day of today. So if you will require a recording of this session, you log into RCT management system and you search the title of this workshop, and that is where you'll find the recording as well as the presentation of this workshop. Now, colleagues, allow me to just quickly go through some few housekeeping rules. We do encourage an interactive engagement. So, colleagues, if you do have any question or any contribution you would like to make, you are more than welcome to make use of a raise a hand gesture, or alternatively, you can just type under the chat or under Q&A, and I will notify our facilitator that someone has a question. You are more than welcome to stop Dr. David at any point. If you do have a question, you just raise a hand and I will notify Dr. David that someone has a question. Also, I'll share the link of the RCT management system of this workshop. So after the workshop, the link will be active for a feedback. That is whereby now you'll download the certificate of attendance. So at exactly 12 o'clock or 1 minute past 12, the link will be then active, and then you log into RCT management system. You go through this workshop title, you fill in the feedback, and the certificate of attendance will be generated. Colleagues, if you are having any problems with the RCT management system, you are more than welcome to send us an email, and then we will assist you. We can either schedule a Teams meeting whereby we'll assist you with your registration. With that being said, colleagues, now let me introduce our facilitator, Dr. Lorenzo David. I'll quickly just go through his bio, and then I'll hand over to him to proceed with the session. Dr. Lorenzo David is the coordinator at the Research Capacity Development Unit within the Postgraduate School at the University of Johannesburg. He recently completed his PhD in biochemistry at the University of KwaZulu-Natal, where his research focused on targeted anti-cancer drug delivery. Driven by commitment to education, Dr. Lorenzo David seeks to inspire students to achieve personal and academic success. He advocates for a holistic, hands-on, and learner-centered approach to education, emphasizing the importance of value-based learning. Colleagues, that was Dr. Lorenzo David. Once again, thank you, Doc, for honoring our invite in facilitating this workshop. Colleagues, I now hand over to Dr. Lorenzo David, who will be guiding us through this session of today. Thank you so much.
Thank you very much, Mr. Nkosi, for that introduction, and good morning, colleagues. I hope you all are well. Can I please ask if we get a thumbs up if everyone is able to hear me? And I will share my screen and put it into presenter mode now. Okay. Mr. Nkosi, I think everyone, are you able to hear me okay?
Yes, we can hear you clearly.
Okay. Perfect. So once again, colleagues, good morning, and thank you for joining us for today's session. The title, as Mr. Nkosi has previously mentioned, is Action Research, Bridging Theory and Practice. I know at first onset the title may seem as if it's something completely new, but I would like to assure you that what we're going to discuss today is actually what many of us actually incorporate into our academic research. The purpose of today's session is to try and tie into some foundational models as well as to provide some real world examples and some tips on how we can go about taking some points from each of these models and using it to improve our own research as well. So today we hope that we will unpack some ideas, especially through some real and impactful examples. And our emphasis will be on practical application and active engagement. We all understand that, while we enjoy researching, we enjoy being either in the lab or doing our desktop research, whatever it may be. We understand that if the application in the real world is limited, then it actually brings into question our research. So us being able to narrow this gap between what we're doing and how it's being applied in the real world, I think can bring about some real world change and obviously potentially positively impact people of South Africa and even globally moving beyond that. So today, for today's session objectives, we hope that you will at least have a clear understanding of the purpose as well as the scope of action in research and its application in academia. We will go through some of the core principles as well as the foundational models. I'm not going to spend too much of time here, but I will provide you links to papers for further reading so you can get a bit of a deeper understanding. I know we have it limited in terms of time. We also hope that you'll be able to analyze some of these impactful case studies from healthcare technology, and there is one for education as well. And we will end by identifying some opportunities for implementing these sorts of rules and models within the UJ context and basically university context, if I can put it that way as well. So, as with any presentation, I'm going to go through the definition, but I think it's important for us to start off with why does action research matter? What is the purpose of it? So we understand that action research actually connects academic theory to real world problems. And as we've said previously, while it's all well and good for us to be doing our research in the lab or wherever it may be, we need to have a sort of an understanding of what is the application of this in the real world. Because when we bring it down to its simplest form, we understand that academic research, the ultimate goal, in my opinion, is that it should have an impact to real world problems. I mean, that's why we do what we do. It's for the love of the subject, and in many cases to bring about change to assist those around us. Now, active research creates spaces for active problem solving, and this happens through structured reflection. And this is where I want to bring in the fact that many of us, when we're sitting, if it's, it was in our master's or PhD, I'm sure we would have faced problems when it came to our research. And without even realizing it, we were actually implementing action research in our studies itself. When you go into the lab, if I look at my own examples, when I went to the lab and tried to synthesize something and it didn't work or it didn't work fully, what would I do? What would any of us do? We'd go back to our desk and we'd kind of try and figure out where exactly did it go wrong? Did it synthesize, but maybe not at the right structure, maybe not at the right size? So through this reflection, it helps us with problem solving, asking these important questions, which help us to actually obviously reach our goal of our studies as well. Now, action research also empowers stakeholders to co-create and own the knowledge generated. When we talk about stakeholders, we're not just talking about, let's just say, scientists or clinicians. We're talking about also the patients. Very often when it comes to implementing a new technology or maybe a new sort of system, in theory, it may look very good. It may seem as if it'll work flawless, but we do understand that there are certain challenges you can only identify through testing. And if we are looking at, let's just say, development of a vaccine or adherence to medication, why, for example, are HIV patients not taking their medication on time? What are some of the factors in it? We can come up with the best theory possible, but by not understanding what are the implications or challenges faced by the patients, the theory starts to fall a bit flat and falls short of where we need it to be. So by working with the patients, in many cases, we see that we can identify, and through many iterations, we can actually come out with a final product which is much more effective, which will work better, and is also adopted much easier by the patients who we're trying to assist. Now, action research will actually lead to tangible improvements in communities, labs, as well as classrooms. And we'll touch on these a bit later on as well. And I think ultimately it strengthens both the scholarship and impact within institutions, by us being able to make our work, give it a greater chance of real world application. Now, if we are defining action research, and this is a definition we can find online, will be action research is a systematic, theory-informed inquiry into real-world challenges. And we'll go through the process in a few minutes. It's not just about trying something new. We have to have a problem firstly that we identify, and thereafter, we have to go and, based on the theory, try and see how are we going to resolve this problem and understand that I like to use the example of writing your thesis or writing a paper. Very often we'll be faced with students who want their first draft to be perfect. And many of us will understand that when it comes to writing a paper or writing a thesis, your final draft is very often going to be very different to your first draft. So I like to use the same example here. It's going to be through iterations, adjustments, reflection in which we are changing our approach, fine-tuning and refining to get the ultimate product which we need. It is conducted, importantly, it is actually conducted with participants. Now, it considers the participants as collaborators, and it's not an experiment, for lack of a better word, that we are performing on them. It's an experiment that we're performing with them, where we are equal in this, because we are also taking in their feedback and incorporating it into our projects as well. Now, as I've mentioned, it involves iterative cycles of planning, acting, observing, as well as reflecting. And now the dual aim of this is to improve local practice as well as to generate broader knowledge. Now, we'll see from a few examples later on when some of these case studies, when the technology was first rolled out, it wasn't rolled out countrywide. It was rolled out on a small population of people who were affected by a particular problem. And what they did is they tried to refine their process within the stage. And thereafter, as they see they're getting more and more success, that is when they started to roll it out to broader communities. And obviously, that can always be implemented and adapted by different fields as well. Now, I think it's important for us to mention that action research relies on collaboration, participation, and critical reflexivity, basically meaning that we can't do this alone. If your area of study involves people where you are maybe taking questionnaires, or if you're a clinician, whatever it may be, we can't work in a silo. We need to be able to get the feedback from our participants and incorporate that into our models. Obviously, we need dual participation from both sides, and we need to have the ability to critically reflect on the results that we're getting. Where are we going wrong? How can we streamline and improve this to produce the best product which is possible as well? So in terms of some of the core models, and like I said, I'm not going to touch too much on this, but I will provide resources at the end of the workshop. So the first one is going to be Lewin's model. Basically, it follows a simple sequence of: you identify a problem, you plan on how to resolve this problem. You put a plan together, as we do with research. You action that plan, and thereafter you evaluate what worked, what didn't work. And I think it's important to understand that Lewin actually laid the foundation for action research, or this theory that we call action research. The next example we go on to is Kemmis and McTaggart, and their model uses a spiral of cycles that builds knowledge through reflection. Now, if any of you, in any of our studies, for example, for myself, when I went to the lab and I tried to make something, I would say about 90 to 95% of the time it would not work on the first attempt. If it did work in the first attempt, I'd be very happy, but research generally doesn't work like that from my own experience. So what do? We understand that this is going to involve a few cycles. It's going to involve us amending, refining, adjusting to get the final product. And what we notice is, just like if we think back to high school physics, how did much of the knowledge that we have today, how did it, excuse me, sorry, the phone is just, much of the knowledge that we've accumulated today is built on basically the knowledge that comes before. We understand that's how academia works. So these are how each of these models are actually building upon each other. Then we go on to the plan, do, study, act cycles. Basically focuses on rapid iterative testing, and the main aim of this is to drive improvement. And this particular model made it practical for healthcare and education. And I think it's important for us to understand that each model offers different strengths, and of course, they also have different weaknesses. And it will depend on your context and goals, which one you will choose to apply into your research as well. I think it's important for us to understand that each of these, or choosing the right model, will depend on your problem in your context, not on a disciplinary silo, basically, not because I'm from biochemistry, originally from biochemistry, that I will only use this particular model. It brings about the example, I think I mentioned this before, where I was talking to one of my professors, and he told me that sometimes when he's stuck on a problem, or when he was stuck on a problem when he was a student, and he's read everything that he could find at the time on that particular topic, and he could not come up with a solution, what he would do is he would start reading papers from fields that were closely related, because sometimes in their methods, you can apply that to your own study. And I think when it comes to academia, we understand that it is evolving, where now collaboration is key. If we want to, for example, if we look at the COVID vaccine as an example, it was not just a group of scientists who got together in a room, somewhere in Europe or or America, and said, we're going to come up with a solution. It worked on collaboration. So once again, when it comes to each of our disciplines, there's much that we can learn from each other, and much that we can use to further, obviously, academia together as well. So I think the question many of you may be thinking, would be where and how exactly does AR, or action research, fit into academic practice? Before I move on with this slide, please can I just add that if at any point anyone has a question, please feel free to unmute your mic, put your hand up, and Mr. Nkosi will just let me know. I'll be happy to take your question. I think it's important for us to have discussion, especially around this, because like I'm saying, each of us has a different perspective. And obviously, in many cases, our perspective is shaped by our different experiences. And in any of these workshops, I always look at it as a two-way street where, I also hope to learn. And I think many of us can also learn from one another in the session as well. So back to the slide. And the question is, where exactly does AR fit into academic practice? So if we've broken it down into 5 separate points. The first one's going to be in supervision. Now, in supervision, action research can improve feedback processes, mentoring strategies, and student support. And I think we've done a few workshops on this, but now we're tying it in together in terms of this model. I mean, if we think back to maybe how some of us received feedback when we were in undergrad, honors, master's, PhD, compared to how we are delivering feedback now to our students, is there a difference? You don't have to answer, but maybe you can just reflect it within yourself. And if there is a difference, what drove that difference? Did you identify something that was not working for you, and you hope to make it better for the next generation of students? And this works through, obviously, iterations as well. You may try something new which you feel would work well in terms of how you're communicating and providing feedback to your students, but you understand that after speaking to them, they don't fully understand, or maybe it's not the way they wish, the best way that they find to receive feedback. So you adjust. And obviously, that's how we go through it as well. The next example would be, and obviously this is a big one, is in research. So it can be embedded within the laboratory, done this without prior knowledge of action research. We all do this in the lab, clinical or even in community-based projects. We work on this model where we will identify a problem, we'll come up with a plan, we will action that plan, and then we'll reflect based on the data we've received. If the data does not reflect what we're hoping for, we try and see what changes can we make to make the experiment work. What are we missing? And critical reflection comes into this as well. Now, also equally as important in teaching, Action research can guide course redesign, and I see there's a big push towards curriculum development. How do we make material more easily understandable, especially when it comes to the core concepts everywhere from high school all the way to undergrad. How do we repackage this information so that the students are able to absorb it better, form a solid foundation, and thereafter go on to pursue their postgraduate degrees, hopefully as well. It can come up with new assessment methods or classroom innovations. I mean, all of this is driven by action research. There's a theory, and thereafter we are piloting a study, and then we are refining and coming out with a new approach, shall we say, or a new innovation. And obviously, we understand that the way in which, if we think about it, the way in which we may have been taught 15, 20 years ago is different to the way that many students would absorb information currently. And in the next 20 years, I think that it will be different as well. If we look at the implementation of AI as an example, we understand that this is constantly changing how students are accessing information. If we look at a simple example from 20 years ago or 25 years ago, when most of your research would have been done in the library with a physical book. And now we see it's moving more towards, well, it is actually currently, you have all the information available at the tips of your fingers on your laptop or your phone. So these are just some examples as well. I think in terms of community engagement, it supports in co-developing solutions with stakeholders. And very often when you present people and you tell them this is what you need to do in order to to get better, without fully understanding their situation, there generally is going to be some sort of pushback, because at the end of the day, it's part of human nature. But if you work with them, try and understand the challenges, the obstacles, and try and streamline the process to actually benefit both the person who's developing the model as well as the patients, obviously this will produce much better results as well. And then obviously we can take all of this together and we can say at an institutional level, action research can inform policies, procedures, as well as strategic initiatives. And it ties quite nicely in both the research and the teaching as well, because we can't be stagnant. We can't afford to be stagnant. We need to be constantly evolving on areas that we have identified as, areas that we can strengthen as well. So what are some of the key features when it comes to action research? Now, I think I've touched on a few of these problems earlier, but we'll go through it here. We'll say that action research starts with a clearly defined context-specific problem. I'll forgive me for doing this, but it's the easiest example for me to provide. But for me, it would be, if I look at my study, what was the problem? Current cancer treatment regimens are inefficient. What is the problem with that? It causes more damage in many cases than it does good. And obviously that is what actually brought about my research study. And each of us would have an equally important reason as well for our research in our master's and our PhD. So we've identified, a problem, a content specific problem. Then we go on, we say that action research is deeply collaborative and involves active participation. So to put it into context for myself, when it came to designing this, this mini system, I could not do it on my own. I needed to go to theories in terms of chemistry. I needed to go into theories and material from biology, cell biology. I needed to go into pharmaceutical. I needed to have all of these knowledge and obviously speak to people in these fields and try and understand, how can I streamline my process? Now, for many of us, for those of us who may have done qualitative research, everything from designing our questionnaires to the stats involved in it, we understand that academia, it has to be collaborative. We have to learn from each other, and there has to be active participation as well. We understand that it is iterative and evolves through cycles of action and reflection. I think I've touched on this quite a bit, where we understand that when we start off a project, If everything works out for you the first time, that is great, but I think you'll be in a very small percentage of people that it actually happens to. We understand that with research, you will face challenges, you will face issues, and we understand that it's going to go through cycles of us making adjustments. I think importantly, one of the key features of action research is that it is grounded in relevant theory, and the ultimate goal of which is to inform change. It aims to improve both practical as well as generate publishable knowledge. Now, we all are very familiar with the term, publish or perish, and essentially where that stems from, in my understanding, would be if I am in a lab in Durban doing some work, and I come up with a cure, let's just say hypothetically, um, you know, hypothetically, and I come up with a cure for a particular disease, but I don't publish it. No one knows about it. Only I know about it. It doesn't really make any real world impact, does it? So when it comes to action research, obviously the ultimate aim is to improve the practice in terms of how is it reaching the end user, how is it reaching, the general population, as well as generating our publications as well, which is, we understand academia is very important. I think we need to understand that when it comes to action research, we need to differentiate it from quick fixes. It's not something that can be done over a weekend. You know, excuse me, it's going to take time. And then if we consider that AR or action research is particularly powerful for supervisors as well as PDRS, as it allows them to generate outputs while improving their own practice, their own skill set, and obviously informing change as well. Okay, so let's look at the action research cycle in practice. So once again, we begin with a specific real world problem or our challenge. Let's think of an example, a supervisor piloting a new feedback process with 2 PhD candidates, right? So the next point is obviously we plan a focused theory-informed intervention to address it. So we've identified a problem, we do our literature review, and then we come up with a plan on how we feel theoretically we can answer this problem. Thereafter, we implement this plan with stakeholders, and then we observe the changes systematically and collect the meaningful data. So this is just basically describing any experimental process, essentially. And thereafter, we will reflect on the outcomes and plan the next cycle. So if I hoped to, reduce toxicity of a particular drug, and I see that in my first iteration, it only reduced it by 2%. Okay, so it's not a success, but it's not a complete failure either. There is a possibility of this working. Where can I go about making these sorts of changes? I think that when it comes to action research, there are small reversible interventions or changes that we can make. It is better to run multiple small cycles than one big rigid plan, because what we're doing is we are fine-tuning each of the individual steps before we reach our destination. So I think it's important for us to even when it comes to approaching research, I think about it in terms of, when I'm talking to a student and maybe they're just starting out their masters and they've got a general plan from their supervisor, and they look at this plan, they're like, I don't know how I'm going to do this. Many of us have been there. I know I've been there myself as well. But then looking back, how exactly did we all accomplish this? How did we get through our masters and our PhD? It was through basically one step at a time and refining each step. If your first experiment didn't work out, you didn't move on to the second one because the theory in the first was right. You obviously made some changes, and thereafter you went into the next step. So I think when it comes to the action research cycle, obviously we're going to follow this. And I think it's a good refresher course for many of us as well. So many of you may be asking in terms of the rigor and validity in action research. So when it comes to rigor, it comes from transparency and careful documentation, something that we will always do in academia. The validity is strengthened by using multiple data sources. Now, if we are doing an experiment where we want to test the efficacy of the COVID vaccine on people, on the human population, we would not choose only a small population of 15 people from a rural community in Africa and say that it's going to work for the entire world. Similarly, we're not going to do the same and take a few people from America or a few people from Europe and say that it's going to work for the entire world. So we need to have multiple data sources, run multiple experiments in these cycles as well. When it comes to obviously discussion of the results, that's why peer review comes in, is so important. That is why we can more accurately trust a peer-reviewed piece of material than we would something that's just put up on a blog, because multiple people checking and validating your results, obviously builds trust in the general community as well. Then we know it is important for us to have an audit trail of records, decisions, as well as cycles. Clearly document everything as we would do. I remember, well, for me personally, it was my lab book. I would, if that lab book had to have gone missing, which it had been misplaced a few times throughout my studies, you feel lost because all of your notes, everything is in there. And a year or 2 years later from now, when someone brings up, why exactly did you do this? Why did you use 10 microliters instead of 5? Why did you go against the literature? Why did you increase the time in terms of this reaction, etc.? Now we will remember it, but 2, 3, 4, 5, 10 years from now, we may not have such a clear answer as well. So document everything, keep it safe, and obviously for later on as well. And I think something that, I thought was important for us to add is, especially when it comes to students, when students come into their masters, generally they're given a project where, it just wants to teach them how to research, in many cases, expand a particular knowledge where possible, but very often the protocols that they're going to be using, from my own experience, I don't want to make a generalization here, but the protocols that they will be using would have been refined maybe by previous students or something that is widely accepted, so most of the time it actually works. But when it comes to your PhD particularly, no one prepares students for the fact that you are going to fail in certain experiments. You are going to fail in certain targets that you have. It's how you deal with that failure. And failure, I like to add, is not always a negative, because in many cases, failure teaches you more than success in a particular, when you are obviously growing your skill set and when you, for example, when you're in the lab as well. I think I've learned more from my failures than I have when an experiment worked the first time. So I think getting this understanding that failure is not bad, it's part of the research process, and we can always add that in, it's not always possible to do it in a paper or in a journal, but if we're giving a talk on a paper that we've published as an example, we can go through some of the what didn't work, because once again, we don't want people to have to reinvent the wheel and go through the same challenges. We want the area to be advanced. Okay, so some of the ethics in action research, once again, we're going to say participants are co-creators. They're not just subjects. We're not just telling a group of people that is afflicted with a particular disease, this is what you need to do and you need to just stick to it, not take into consideration their abilities, their challenges, etc. Consent must be ongoing and cycles often shift. The power dynamics should be acknowledged as well as managed. See it as a collaboration. The risks as well should be shared, not pushed onto participants, where I, as a researcher, think, what? The theory says that this vaccine should work. I am 95% sure that it is not going to cause anyone any harm. That means that if I'm wrong, I'm not sharing any of the risk technically, because I'll say the theory was sound, but the participant is actually going to be facing the backlash, and will be affected by the risk as well. So in action research, the risk should be shared and not pushed onto the participants, and feedback must always close the loop with the collaborators as well. I mean, obviously, constant discussions as well. So when it comes to measuring what matters, in terms of action research, our measures should always align with the specific aim. We understand this, right? It's from our academic research, we understand. When it comes to the next point, choose simple measures that can be collected frequently, because we're going to collect as much data as possible and give us an indication, is this working, is this not working? Include both process measurements and outcome measurements, obviously when you're doing your recordings, and visualize progress with basic graphs or charts. In the beginning, obviously when we're getting our data, and we're just happy that we've done the experiment, we write in our lab book and we go home, we can't identify trends. So a simple tool obviously would be plot your graphs early, start adding in information and start adding in your data as you go, and you can identify trends. If you see the trend is moving in the opposite direction to what you actually are hoping for, then you would not have wasted 6 months. You may have only wasted a month or 2 months. You're saving time, and obviously you can make adjustments in real time as well. I think the important point here is that we need to focus on learning and not just proving success. And this is this is quite a sensitive topic. It just depends what reason or why we're in the field that we're in as well. It's a very personal thing that we can reflect on as well. I mean, when it comes to, many of us have chosen academia, because of the love for it, and when you choose academia, basically you have a love for learning, or that's my interpretation of it as well. You always want to improve your skill sets. It's not about proving how good you are, but basically expanding your knowledge and being able to make as much of a change as possible as well. So after I've gone through all of the theory, I think it's a good point for us to go through a few case studies. I think I have 2 case studies or 3 case studies that we will go through. And the whole point of these case studies is to link up how the theory was actually developed into a program which was refined through collaboration with the community. And thereafter, we see that these programs were much more successful if we had just developed this system in a silo and obviously rolled it out to the population as well. So when it comes to newborn survival, obviously we understand that it's a very delicate time for babies, and at the same time, we know that doctors have a lot of knowledge. Medical practitioners have a lot of knowledge when it comes to what is some of the biology, what is some of the psychology, what are some of the physical aspects that affect newborn survival. But at the same time, it's the mums and dads who actually are with the baby 24/7, who are watching them, adapting, and obviously trying to adjust to ensure that the child is healthy and growing well. So what we'll see in the first case study here, which is related to healthcare, is women groups and newborn survival, and how this relationship actually helped us to reduce reduce deaths, neonatal deaths. So women's groups use participatory learning and action cycles. Basically, they worked with the researchers and the doctors, and they were able to co-identify barriers to safe childbirth as well as newborn care. Once again, we are talking to one another, we're learning from one another, we are implementing these changes, and obviously the end result is generally much better. So local solutions were developed first, right? They identified a problem, they came up with a plan. There was a conversation that happened and they came up with a solution. The solutions were developed and tested within a community, right? Feedback was generated from the community, and obviously that feedback was incorporated where possible into the system. And thereafter, once they saw that, what, we are actually reducing the number of babies who are passing away, we are making childbirth actually safer by making these changes, and obviously these sorts of decisions can be implemented into, let's say, law and some of the regulations. And thereafter, after we see that it works on a smaller scale, the approach was scaled across countries in Asia and Africa. And what was the result of this? You see, there was significant reductions in neonatal deaths were reported. And I think when it comes to something as sensitive as this, when it comes to neonatal deaths, I think this sort of interaction actually highlights the power of action research, the ability of it to quickly, relatively quickly, efficiently, come up with a solution that brings real world change and real world impacts, from it. So we're going to go through why exactly did this, why did this case study work? Why did this approach work? So it's based on the theory of empowerment as well as collective action, right, which drove the success. Solutions were practical as well as matched to local realities. And I think this is the important thing. When we are working on a particular, we've identified a problem, we're trying to come up with a solution. We also need to understand that there are, and many of us do, I'm sure, we also need to take into consideration what are some of the challenges that the locals are facing, and how do we adjust our plan to accommodate them to ensure that they take their meds, or they have access to healthcare or the correct information, etc., so that we can save lives. I mean, I think it's important to understand that here iterative cycles allowed for ideas to be tested as well as improved. It's not just one, two, three, or four people coming and saying this is the way it's going to be done. Greater number of minds, the greater number of inputs that we can put together, obviously critically analyze what they are saying and incorporate that into the program. That is what contributed to the success of this particular program. I think here community ownership created long-term sustainability. If people can see that you're working with them, right, that you are listening to what they're saying, you take into consideration some of the challenges that they have. What we're doing is that we're reducing the number of obstacles that participants would have in using this particular model of the service, and therefore there is longer term sustainability. It's not just a quick fix where it's in a wave where people are all excited, they follow this particular plan for a couple of days or a couple of weeks or a couple of months, and after a while they see that what, it's not really lining up with my lifestyle. It's preventing me from doing A, B, and C. Maybe I can skip a day, maybe I can skip 2 days, and obviously what happens is the entire system will fall apart thereafter. And obviously why it worked is that once we showed through our experiments and our data that this is working, governments and the World Health Organization endorsed the model for policy use, and obviously that will bring about greater change as well. So the second case study we're going to speak about is related to technology and health, and it's basically your mHealth projects. So two examples we're going to speak about here. The first one is Ghana's Motec, and the entire aim of this was to connect mothers to maternal and child health services. What exactly does this mean? Participants were able, through voice messages, through texts, they were able to access information relating to what should you do, when you're pregnant, when you're approaching your pregnancy, during your childbirth, when it came to you have a newborn and how to look after them, because we do understand there's a lot of cultural knowledge that many of us have, that will be passed on from generation to generation. But we understand that also healthcare is evolving, and some of these key information, would be able to assist mothers. So it actually was quite a big success, which was actually rolled out later on as well. So the features were shaped by basically participant design with the community, and the approach was tested, thereafter refined, and then scaled nationally. We see a trend that's happening here. We come up with a problem, we identify it, we come up with a plan, we test it, we refine it based on the data that we have. Once we start to get more reproducible results, we see that it's working. Thereafter, you scale nationally, or you scale it, whatever it may be. There's the next one will be the Cancer Care App Thrive, was built through cycles with patients and clinicians. Here, once again, it is a collaboration between two groups involved in the experiment. Both these examples show how your actual research principles can be applied in digital health and innovation. Okay, and quickly to go through why exactly did it work? Why did case study 2 work? There were small cycles, and I think one of the key thing is when we are trying to maybe draw on some points from these case studies, we focus on these slides. Why exactly did it work? They worked in small cycles. It allowed features to be tested and improved more rapidly, right? Instead of waiting 2 or 3 weeks, we can obviously do it much sooner. Usability issues were treated as learning opportunities. We understand that the first product that we're putting out is the beta test, right? Well, it's going to be the first test that we're having. We are going to refine this. So when we are getting feedback, the way in which we're approaching it is going to be slightly different. The user feedback was integrated as data and not as an afterthought. Basically, it was used to inform how the system is going to be changed. And the iteration built trust and ownership among the participants. If we think especially between clinicians as well as the individuals who are involved in the clinical trial, because that relationship, and if you try to put yourself in that position, if there's no trust between these two groups, it can cause some serious issues, obviously with the patients as well, where they may not feel that the clinicians have their best interests at heart. So building up this trust is actually important, and obviously ownership among the participants. And lastly, the process was actually published alongside the product for transparency. So once again, they did this experiment, they saw that it worked. They didn't just keep it within a silo or keep it hidden away in a book on the shelf. They actually published it, which is obviously what all of us aim to do. And basically, we publish it alongside the product to allow transparency and basically allowing people to use our particular systems. So we're going to quickly go through what are some of the common pitfalls as well as how to avoid them. Remember, we said when it comes to action research, we're going to try and work in small cycles, right? If we are simple example, if we're synthesizing a particular nanoparticle, as an example, we're not going to try and alter size, shape, or conductivity all in one go, right? We're going to target one characteristic at a time. So once again here, trying to do too much at once will actually make the cycles unmanageable. A vague aim and measures lead to unclear findings. So we need to know exactly what we're looking for. And many of us do this obviously in our studies. Poor documentation weakens the rigor and credibility of the work. We don't want to rely on our memory. Obviously it's important for us to remember. What I'm trying to say is have the documentation to prove what we are actually publishing at the end is actually, this is what happened. These are credible results. Token participation limits ownership and sustainability, essentially meaning that we just see the participants as subjects. So if we work with them, we understand there's going to be greater sustainability because they have an input, they invested into this particular system. And stopping after one cycle misses opportunities for deeper learning. So if you obviously go through an experiment the first time and see that it did not work, it does not make sense for us to actually give up on the entire project. I know it's just a point that I want to make. I know none of us would do this. So continue to see it as a learning opportunity as well. So last example we're going to speak about is going to be action research in vaccine and TB work. Now, once again, I'm not going to go through all of the points because I think we've discussed quite a few of them previously, but we need to look at this. When they considered how to improve this, they looked at it as a collaboration between the researchers as well as the participants who will be taking the vaccines, but more importantly, those who would actually be taking the HIV as well as TB medication. Now, this is a good example of how action research has been incorporated into real-world applications. So TB projects have used action research to strengthen continuity of care. We understand that with TB, you have to stick to your regimen of medication over, I think it's about 3 months in many cases. If you happen to miss a day, it throws your cycle off and it actually puts you at risk of, you're not being completely cured of it and reinfection as well. So what they've done is, in many of these cases, they identify why exactly are people not sticking to the regimens? What are some of the limiting factors that they have? And obviously, they incorporated this feedback into the system that they're developing. The same thing can be said of HIV adherence. Basically, HIV adherence clubs evolve through iterative community-led cycles. It's never going to be the first time it works out 100%. And co-designing intervention reduces stigma as well as builds trust. If you are involved in a particular project, you have a deeper understanding, there's transparency. obviously you're going to be more willing to join to obviously participate in this particular study. And I think it's important for us to understand that lessons from public health can inform other disciplines as well. The approach that they're taking here, we can modify that approach in our own specific discipline, and obviously use it to improve our outcomes as well. So we're approaching the last few slides. I'm not sure if there's any questions at this stage, but I think what I'm going to do is, if there's any questions, please feel free to raise your hand or type in the chat box. And I think I have a few more slides, and then we'll open up the floor for hopefully some discussion. And I'd love to hear some of your thoughts as well on what we've spoken about today. So reflecting on today's session, we understand that action research is basically the bridge that connects theory and practice. And it does so in a very powerful way. It gives academics the tools to address real challenges, and it does this collaboratively. Small cycles, and this is a key here, small cycles can lead to meaningful and scalable change. I think I may have mentioned this previously on our lab door. Our supervisor put up a little saying. I'm not sure who the source or who originally said it, but it was, a little work every day adds up to big results. I think there's a big results at the end of the year. And I think it's a similar concept we're talking about here. The smaller cycles, can lead to meaningful and scalable change, and us pushing through as we would have to do in academia. The examples we explored showed impact across various disciplines. And I think there was an example of education, which actually, I don't know if I've actually put it in here, but we can discuss it hopefully in the discussion section. And basically, your context will offer rich opportunities to be able to apply these ideas. And it obviously will be based on your experience as well. So I just like you to think about something, if you're not comfortable, completely understand, you don't have to type anything or say anything, but maybe just reflect. You're more than welcome to type a message. That's fine. But just reflect on this. What's one idea or an example from today that you can take back to your own context or to your own discipline? What can we incorporate from action research? Maybe we've been doing most of it, but there's one aspect that we have not thought about or we're not aware about. What is one example we can actually incorporate into our own context as well? So some of the key takeaways here is going to be, firstly, start small. We identify one problem, we have one aim, one cycle. Ground your actions as always in the relevant theory to strengthen the rigor. Involve stakeholders meaningfully from the start. I think, this is where I'm just thinking about this now. Obviously, when we're working with people, when we're working with human subjects, it's easier to involve the stakeholders meaningfully from the start. But if we're working, let's just say, on the synthesis as an example, who exactly would be the stakeholders there? Maybe in that case there, we need to look at the relevant literature or speak to people in those particular fields who use or apply that technology as well, to see what exactly some of the challenges. So when we are designing the system, it's not just going to work well in paper or work well in a test tube or a culture flask. It's going to be applicable real world, and we're speeding up that process when we implementing the changes in the initial design. As always, document our processes carefully for learning as well as publication, and we keep iterating. We keep going through these cycles. One cycle will lead to the next, one cycle will teach us something, and we will also learn from our failures as well. We need to understand that stakeholder collaboration and clear documentation are non-negotiable. The iteration will transform quick wins into lasting change. And we encourage, basically, we encourage you to have a checklist as well when it comes to, obviously, in terms of your documentation, just so it makes it easier when you are, obviously, when the information may be requested or you are requested to upload your raw material when it comes to a particular publication. So Last two slides that I'd like to speak about. The first one's going to be staying connected. We understand, and hopefully we understand from this talk, that action research grows through shared learning communities. We can't work in silos, or we can't work in isolated disciplines. We all need each other. And with that, I would suggest, in terms of collaborating with peers, and through collaborating with peers, it accelerates impact as well as scholarship, and allows us to advance our particular areas as well. So as promised, these are some of the resources and further reading. So you'll be able to find these papers. If you would like, I can always attach them in terms of the resources. I can link them into the presentation afterwards. And I think just to quickly recap, Lewin was basically, it's important in terms of historical roots. Chemist is for educational framing. Then we look at Reason and Bradbury for the theory, Taylor for healthcare implementation, and the World Health Organization for practical tools. So if you would like, you can always link these particular resources to this presentation. But with that, I'd like to thank you for your attention. I'd like to thank you for joining the session. I'd hand over back to Mr. Nkosi now, and we'd be happy to take any questions that you may have. Hopefully, we can have some interesting discussions. But Mr. Nkosi, thank you. I'll hand over back to you.
Thank you, Dr. Lorenzo David, for such a great presentation. Colleagues, now the floor is open for questions. So if you do have any question, you are more than welcome now you can just unmute your mic. I've enabled everyone's mic at the moment. You can just enable your mic, unmute your mic and ask a question, or you can just type those questions under the chat and I will notify Dr. Lorenzo David, or he will just go through your questions. So let's give it 30 seconds and see if we have any questions. And also, colleagues, I've shared the link of this workshop under the chat. So just after 12, which the recording will be available, as well as the feedback will be active. That is where now you will download your certificate of attendance for this workshop. So just after 12, it will be available. The link should be active by then. Okay, I see we have a comment from Dr. Gold. Thank you so much for the informative presentation, Dr. Lorenzo. Thank you, colleagues, for that.
Thank you very much. So I think, Mr. Nkosi, if it's okay with you, if there's no more questions, maybe I have a question for the participants today, for each of you today. When it comes to action research, and I think I'm going to go back to the question that I asked originally in the presentation. When it comes to action research, and now, we understand a bit of the theoretical background on this. In your opinion, based on your experience, how can we, what do you think would be the best way for us to implement this so that our research actually leads to, let's just say, real world change? Is there any ideas, or anyone has any opinions? Is this possible? Is it not possible? Maybe you've identified some challenges. Anything that you'd like to add, we'd be very grateful, because to hear your perspective, and I think we all would be able to learn from it as well. So I'll just leave that question out there and hand over back to you, Mr.
Okay. Thank you, Doc. Colleagues, you can make your contribution, or you can answer the question for Dr. Lorenzo. Yeah, it seems like it's quiet here. Colleagues, if you would like to make any contribution, you can just unmute your mic, or alternatively type under the chat.
I think, Kosi, if no one has any questions, then what I can do is I'll type in my email in the chat. And if at any point anyone would like to maybe discuss this further, please feel free to send me an email. I'd love to have a discussion with you and kind of hear your perspective as well. So if you don't have any questions now, then please feel free. You can always contact us later as well.
Thank you, Dr. David. Dr. David, email is now on the chat. So if you want to reach out, you can just email him directly. He will be happy to assist you. With that being said, colleagues, thank you so much for your attendance, and thank you so much to Dr. Lorenzo David for taking his time in facilitating this workshop of today. Be in a lookout for other workshops that we are offering in this week. We will send out the reminders for those workshops that we are currently offering for this week and for the month of October. So thank you, colleagues, for your support once again. We wish you a great day further. And remember, if you are having a problem with regards to registering on the RCTMS, you are more than welcome to email us, and then we will assist you, schedule a meeting, and assist you with the registration. We will no longer be sending out certificates via email, so you can just download your certificate of attendance via the RCT management system. Thank you so much, colleagues. Have a great day further. I'm now officially ending this workshop. Thank you.